Respiratory papillomatosis. Definition: is a rare disorder caused by the human papillomavirus, characterized by the development of small wart-like growths, papillomas, in the respiratory tract. Papillomas can develop anywhere along the respiratory tract, but they mostly affect the larynx and the vocal cords.
Hello guys, this is Indian Medico, and in this video we are going to see about laryngeal papillomatosis or respiratory papillomatosis. This is a concise presentation for medical students. Laryngeal papillomatosis is also known as glottal papillomatosis. It is a rare medical condition caused by human papillomavirus infection of the throat. It has bimodal age distribution, that is, it is common in two age groups. It is common in children who are less than 5 years, and it is common in people in their fourth decade of life. Depending on this, there are two types of laryngeal papillomatosis. They are juvenile laryngeal papillomatosis and adult onset laryngeal papillomatosis. Juvenile laryngeal papillomatosis is the most common benign neoplasm of the larynx in children. Now let us see about the etiology of juvenile laryngeal papillomatosis. It is common in children between 3 to 5 years. It is caused by HPV virus type 6 and 11. Remember that HPV virus is a DNA virus. It is thought to spread from mothers who had vaginal HPV disease. Now let us see about the features of juvenile laryngeal papillomatosis. It mostly affects supraglottic and glottis regions. It can also affect subglottis, trachea and bronchi. The DNA virus particles are present in the cells of basement membrane of respiratory mucosa. This is thought to be the reason for the widespread involvement and recurrence of this condition. In children who have undergone tracheostomy, there is a risk for tracheal and stomal involvement due to seeding. Now let us see about the symptoms of juvenile laryngeal papillomatosis. There will be hoarseness, there will be aphonia, that is, the child will be unable to produce voice. There will be stridor, that is, high-pitched whistling sounds during breathing, and there will be respiratory difficulty. Now let us see about the diagnosis of juvenile laryngeal papillomatosis. Diagnosis can be made by flexible fiber optic laryngoscopy or direct laryngoscopy or by biopsy. This picture shows a patient with laryngeal papillomatosis. Now, how do you treat a case of juvenile laryngeal papillomatosis? Excision can be done by microlaryngoscopy and carbon dioxide laser. If these two are not available, cup forceps and debrider can also be used. Recurrence is common in juvenile laryngeal papillomatosis. The aim of the surgery should be to maintain a good airway, preserve voice and avoid recurrence. So, the surgery should be done with absolute precision to avoid damage to the underlying vocal ligament. Medical treatment includes interferon alpha 2A and 13-cis retinoic acid. However, medical treatment is avoided because of the severe side effects. Now let us see about adult onset papilloma. It is more or less similar to juvenile laryngeal papillomatosis. However, a few differences are there. It is usually single, it is smaller in size, it is less aggressive, it doesn't recur, it is common in men between 30 to 50 years of age, and it affects the anterior half of vocal cord or anterior commissure. Thank you.
Applications in medicine. The most common presenting symptom is hoarseness. Hoarseness may become progressive worse as the voice of an affected individual may be weak or sound low in pitch or strained. The severity of voice problems can vary from one person to another due, in part, to the size and a specific location of papillomas. Affected individuals may develop labored, noisy breathing, stridor, due to obstruction of the airway. Some individuals may exhibit difficult speaking, dysphonia, or lose their voice entirely, aphonia. Affected infants may also have a weak cry episodes of choking and fail to grow and gain weight at the expected rate. Failure to drive. Additional symptoms that can develop include a chronic cough, difficulty swallowing, dysphagia, shortness of breath, or difficulty breathing, dyspnea, the sensation of a foreign body in the throat, and choking episodes. Pros and cons. Pros. Patient treatment in chemotherapy with cisplatin and radiotherapy followed traditional surgery and carbon dioxide laser surgery and no-touch removal of affected tissue are forms of treatment for laryngeal papillomatosis. Carbon dioxide laser removal is the most common removal method. The carbon dioxide laser must be used precisely to prevent scarring, fibrosis, and laryngeal web malformation. Many antiviral drugs, like Cidovir, have been used to treat laryngeal papillomatosis, but none completely stops the tumors from growing. Cons. Treatment of chemotherapy and radiotherapy. It has not been a reducing of malignant tumor in the larynx. A tracheotomy was performed so can breathe properly because this tumor covered the airway.
Oh, just breathe in. All right. Now let's do some more here. Okay, turn to the left. Just going to do a little contact reaction now. Contact mode, I mean.
Issue applied in Ecuador. In a study from 2017, there were 78% patients diagnosed with HPV infection. Of these, only 22% developed recurrent respiratory papillomatosis.
Jacob loves playing one-on-one against his dad. He's been doing it for many years, but a medical problem has made playing basketball more difficult for him. At the age of 6, Jacob was diagnosed with recurring respiratory papillomatosis, a benign growth in the larynx or voice box area. The growth caused breathing and speech problems.
I'd breathe harder, faster than everybody else. So like I'd have to stop and catch my breath a little more. I got hoarse more, and then like I couldn't yell sometimes.
Papilloma is not a common problem in kids.
After the first year or so.
But Dr. Diane Heatley, a pediatric otolaryngologist at American Family Children's Hospital, quickly recognized it.
For me, it doesn't seem like a real foreign thing, but that doesn't mean that others would necessarily recognize it. So that is the advantage of being at a referral center. All of those papilloma cases would come in.
And they just, from that moment, just cared about us.
For Jacob's mom, Lori, a routine checkup turned into the first of many visits with Dr. Heatley.
They just explained really nothing about the disease, just that we have to be here in the morning and this is what we're going to do and it'll be okay. And then after the surgery and after every surgery after that, she'd come out with pictures and explain to us everything.
And there were a lot of minor surgical procedures. Jacob, who recently turned 18, has been through more than 35 surgeries. There's no cure for papilloma. His tumors grow back every 3 to 6 months. He has trouble breathing and speaking, goes in for surgery, and gets relief until they grow back again.
Well, welcome back, I guess, is in order.
Now, new surgical technology should make the procedure easier for Jacob. He recently made a seamless transition from pediatric to adult care. His adult otolaryngologist, Dr. Seth Daly, can use a cutting-edge laser technology targeted specifically for adults.
The new generation of lasers that targets blood vessels within the papilloma while still preserving the deeper structures that vibrate is very, very exciting and allows patients to have ongoing good voice function even after 35 surgeries. Furthermore, this new generation of lasers can be used in the office with someone awake sitting in a chair, so not only can they go back to work or school or whatever, but there's no sedation, there's no anesthesia, there's nothing. They wear street clothes just like you and me.
Being only an hour away from a research institution, which I think has a lot to do with it, is amazing.
Jacob can now drive himself to and from his surgeries, and there's hope that one day he may not need them at all.
With individuals who contract the disease as kids, so pediatric form, eventually their disease tends to burn out as they become adults.
Oh, you made it.
Conclusion. To conclude, there is not cure for this disease. Treatment is directed toward removing papillomas, decreasing the spread of disease, creating safe and patient airway, preserving nerve anatomic structure, improving voice quality is necessary, and increasing the time between surgical procedures.
Hi, I'm Dr. Vonda Donovan from Pediatric Infectious Disease. A lot of parents and families wonder how contagious HPV is and if their children can get JRRP easily from other people, and also have questions about how to prevent it. Children cannot catch JRRP or HPV by playing with each other or by sharing utensils. Siblings cannot be infected through regular household contact. There's currently only one vaccine available in the U.S. to prevent HPV, the virus that causes JRRP. Gardasil 9 is a vaccine that provides protection against the 4 HPV types that included in the first Gardasil, 6, 11, 16, and 18, as well as 5 additional types, 31, 33, 45, 52, and 58. Type 6 and 11 are most associated with genital warts, as well as JRRP, and the others, especially 16 and 18, are associated with cervical cancer. Cervarix, which is a bivalent vaccine containing only type 16 and 18, is no longer available in the U.S. and would not have provided any protection against the HPV types causing JRRP. Gardasil 9 is now approved for people 9 to 26 years of age, is very safe, is typically well tolerated, and causes a very strong immune response, providing long-term protection against HPV. The current recommendations for both boys and girls to receive 2 doses of the vaccine at least 6 months apart, starting at age 11. Adolescents and young adults 15 and older need to receive the previous standard of 3 required doses. Infants and young children cannot be protected directly with the vaccine, but may be protected if their mothers were vaccinated as children or young adults prior to HPV infection. Firstborn children are at greater risk of developing JRRP during delivery, but there is no way to predict the individual risk for a subsequent child, as the level or presence of HPV will vary over time. Women should receive all recommended care to make sure that there are no active HPV infections that would raise the risk of transmission to a baby during delivery. They should also discuss with their obstetricians regarding their personal risk factors that might make a cesarean delivery necessary. Catch-up vaccination is currently recommended for women up to age 26 and for most men up to age 21, in some cases 26, who did not receive the full HPV series as adolescents. However, the FDA recently approved HPV-9 or Gardasil 9 to be given to adults up to age 45, as they might still receive protection from virus types they've not already been exposed to, but may be in the future. The official CDC recommendation from the Advisory Committee on Immunization Practices has not yet changed, but may do so in the near future, as there are many types of HPV. Even if a child has JRRP and is type 11, for example, receiving the vaccine would still provide protection in the future against the 8 other types that are included. If you have any questions about HPV or JRRP and its infectious cause, feel free to talk to your pediatrician, who can always reach out to us in Pediatric Infectious Disease for further consultation. Thank you.
Thanks.